And now let's bring in Dr. Natalie Azar. Natalie, good morning. And I want to start with this indoor dining. And I'm just now starting to feel kind of comfortable with outdoor dining, but now a lot of restaurants opening up indoors. How do they keep it safe? What are their biggest concerns?
Yeah, well, Dylan, certainly the data from this summer has definitely showed that a lot of community outbreaks did happen in the setting of restaurants and bars. And I think you can think about the risk of dining as sort of a graded risk, with the lowest risk being takeout, delivery, drive-through, curbside, and the highest risk being associated with indoor and outdoor dining on site where they haven't reduced capacity and haven't been able to space patrons a good 6 feet apart.
So is that what restaurants need to do if they space people 6 feet apart inside? Do they have to change their whole HVAC system within the building? What makes it possible for folks to dine inside?
Right. So CDC has great guidance for restaurants on this, and I think you can sort of subdivide it into two different categories. One could be physical, and one I'm categorizing as techie. So for physical, yes, you want to reduce capacity so you can space people out. You can put up plexiglass barriers between the hostess or even between diners, and also have tape on the floor so you can tell where you're supposed to go and where you're supposed to be seated. For the tech stuff, I'm sure you guys have all seen this before, these virtual menus, where seriously, my kids have to help me with that sometimes, but also instead of using buzzers to tell you that your table is ready, you have an app that does that, touchless payment, all these things that enable us to avoid shared objects, and some other things like, ordering ahead of time so you're not spending so much time in the restaurant while waiting, and just generally using a lot of disposable things, utensils and things like that. Again, just not to be passing around and sharing germs from one person to another.
So let's talk about another huge indoor activity, school. New York City just pushed back the start date of in-person classes. They're rolling out monthly randomized testing for the teachers and for the students. So is this a good way to track positive cases, this randomized testing? And how safe is it to take classes in person right now?
To go to school, boy, if we had all day to talk about this. So let's start with the fact that public health experts have been saying literally for months now that we would love to be able to have these rapid point of care tests, whether it's saliva or antigen testing, to be able to test large swaths of people who are going to be in congregate settings, whether it's schools or factories or things like that. So what I would say is some testing intuitively is better than no testing at all. Is it going to be enough? I don't know, and I think time will tell. I don't like to say that when it has to do with illness and people's lives, but truly I feel like that's where we are with this. I think that testing, it's important to keep in mind that it's one part of safety, prevention, mitigation, in addition to adequate ventilation, socially distanced desks, making sure that students and educators have appropriate masks and PPE. One of the most important things, and they highlight this also in the New York City, release, is that if there is a positive case in one classroom, that whole classroom is quarantined and contact traced. If there is more than one class affected, the whole school shuts down and the school moves to remote learning. If the 7-day average positivity in the city is 3% or higher. So again, the testing part is just one piece of this very moving puzzle board. We'll see what happens. So many factors to take into consideration regarding back to school that we're all dealing with as parents and educators and everything.
I know. We could talk about it all day. We all have so many concerns. But Dr. Azar, Dr. Torres, thanks for calming some of those concerns. We appreciate it.